Thank you, Shah. Good morning, good afternoon, and good evening, depending on wherever you are joining from. We have a very interesting topic today that's on building for the future, modular, interoperable digital public infrastructure for health, evolution of the SMILE initiative. This webinar is from the United Nations International Computing Center, UNICC team, together with SMILE. And just a quick introduction I will do. UNICC is the largest strategic partner across the UN system, providing digital foundations. It provides a central role in operationalizing digital public infrastructure to support its clients and partners' mandates and impact. And this webinar will feature an example from our own region, that is the Electronic Health Inventory and Logistic Monitoring System, SMILE, from Indonesia. So SMILE was initially developed to support vaccine distribution and logistics for routine immunization programs in Indonesia. The effectiveness of SMILE was quite evident during the COVID-19 pandemic, and when it enabled rapid distribution of hundreds of millions of vaccine doses to the regions nationwide. Beyond immunization, SMILE has expanded to support additional health programs, and then from what I remember, to strengthen the national health supply chain, there was a decree from the government that enabled SMILE to be designated as part of the Satu Sehat, One Health digital platform from the Ministry of Health Indonesia. So briefly, the learning objectives of this webinar will include understanding the principles of modular open source digital public infrastructure and how applying these principles from the outset enables health solutions to scale cost effectively and adapt to evolving national needs. And the integration of interoperability standards and the ecosystem, such as linking logistics platforms to national data systems, supporting real-time decision-making and improving how it can improve the health supply chain performance. Also to identifying key enablers and lessons learned from the SMILE initiative as a model of sustainable health DPI, and to recognize the role of South-South cooperation in advancing equitable digital health transformation and access how nationally proven digital public goods can be responsibly adapted and replicated across different country contexts. So just to give a gist of the speaker profiles, joining us is Emily Bennett. She's a dedicated advocate for open source. She's passionate in driving business value through development and implementation of innovative, reusable, and scalable digital products. She leads the public solutions team at the United Nations International Computing Center, UNICC, UNICC's Digital Solutions Center, which focuses on designing and implementing digital public infrastructure. So, and then the UNICC actually caters to very diverse range of stakeholders, including the UN agencies, development banks, nonprofits, and the governments. And our other speaker is Senan. She's a business relationship manager at UNICC, bringing 2 decades of experience across IT services, manufacturing, and the UN system. Formerly at the UNICEF, she now leads UNICC's partnerships with clients such as UNDP, driving digital transformation and supporting sustainable operations. She leads several strategic engagements for digital health and digital identity, focusing on long-term collaboration and aligning technical capabilities with the evolving needs of member states and UN agencies. And our third speaker will be Vidia Darmawi. She works closely with Indonesia's Ministry of Health, including the ASEAN-wide initiatives, has had experience in HIV and community-based data systems, led her to vaccine data system, which were instrumental in Indonesia's COVID-19 vaccine rollout, and now to be expanded to cover all medical products across more than 25,000 health facilities. Working with UNDP, she has led digital transformation in health project implementation across Indonesia's vast and hard-to-reach geography, and strengthened the system through collaboration with UNICC. And our next speaker is Shweta Pujari. Shweta is a solutions delivery manager, health solutions at UNICC with over 2 decades of experience in enterprise systems delivery. She leads the design and implementation of digital solutions that support global health programs and mission critical operations. In her current role, she leads cross-functional, geographically distributed teams to deliver scalable, secure, and high-impact solutions. She collaborates closely with clients and stakeholders to ensure alignment with organizational priorities while driving service delivery excellence, system reliability, and continuous operational improvement. With this introduction, I would like to hand over to our speakers. Emily, Senan, Vidya, and Shweta Pujari. And just a quick thing, this webinar also comes to us at a very important time when EHIN, in few weeks from now, is going to organize its general meeting in Jakarta and very much on the topic investing in digital public infrastructure and responsible AI for health. And then so it is very opportune for us also to have this webinar as well as the example from our own region, from the country that is going to host our next general meeting. Over to you. Thank you.
Thank you very much, Jay Ganesh, and to the entire AE community for a warm welcome. We're excited to be with you today. I'm just going to take a moment to share my screen so that I can prepare the presentation that guides the conversation for us to share. And just a moment while I go to slideshow mode. Great. So we're really excited to talk to you a little bit more about UNICC and to talk about our public solutions offerings as a construct through which we supported UNDP in Indonesia in the SMILE initiative and SMILE solution. The first part of our slide deck is going to be to talk about the construct of UNICC, and then the second part will get into the more substantive overview of the solution, the context behind it, the evolution, the different modularity aspects, and then the transferability of technology and the construct in which it was architected, meaning the potential or the realization of South-South collaboration in the context of SMILE. So I have, there we go. So perhaps some of you have not heard of United Nations International Computing Center before, or the UNICC. We've been around for quite a while, 55 years. We have a variety of different types of clients. Jay Ganesh mentioned the client profiles, but we serve over 100 client and partner organizations. A key factor in that is that they're nonprofit or government entities, UN system partners, for example, like UNDP, which is the conduit in which we worked with Indonesia for SMILE. And UNICC is a UN entity, so we're nonprofit. So we have to serve nonprofit entities or government institutions. We have lots of different types of services and solutions. Some of those are, kind of your traditional IT services like cloud hosting options. We run lots of different shared ERP solutions. We run a variety of different digital workplace solutions, for example. But especially in the recent past, we've been involved in delivering digital public infrastructure and constructing digital public goods, simply because UNICC has a strong capacity in tech, since it's all that we do. And so we've been involved in growing and productizing many, many different solutions. So I'll get into that a little bit more in the future. But really, this is all under the mandate of UNICC in the context of delivering scalable, trusted, and furthermore, cyber secure or trustable digital public infrastructure and goods. And so we have a variety of different pillars and services through which we do that. We operate in 5 different strategic and operational locations, but Shweta mentioned, or I think Jay's introduction of Shweta mentioned that she's working with teams across the globe. It really is the reality that we have folks sitting all over the globe in order to deliver services. But we have 5 institutional locations. We've been delivering public solutions for a long time. Whether that's the work of the UN or it's working for the UN in the context of the operations of the UN. So more than 50 years, we've been a technical backbone. And in that construct, we're a technical advice partner, an architecture partner, as well as implementation. So you'll see aspects of that in the context of SMILE and in the use case. And really, our core mission is advancing the SDGs. So for us, advancing open, inclusive, and fit for purpose solutions is very key. I have a cat who wanted to join our meeting, so I'm just going to take a moment to let her go. And so all of these really help institutions to scale public services effectively. Many of the solutions that we've been using for a long time, certainly before definitions of digital public infrastructure and goods were more common, we've really kind of defaulted to open source solutions simply because of the ease of transferability in technology. So open source and open standards is a methodology or a resource that we've been using for a long time in terms of constructing goods or constructing end-to-end solutions. And so many of those solutions align to DPA standards or the DPI indicators because it's some of the core tenets in feasibility of transferability, autonomous operations, in the construct of build to train and maintain, sustain, for example. Because we're concentrated in tech acumen, we're really a tech builder and meeting the sector expert in terms of nonprofit, institution, UN. So we have that acumen that's behind how we work. And that often becomes really important in the diplomacy, especially if you're working across a diverse set of stakeholders, and especially in the context of DPI, because it can be quite a broad and multi-stakeholder initiative, specifically if you're talking about constructs of identity or some of the foundational DPI components. Never mind the constructs of different entities that would be leveraging health technologies as well. Reusing smart is the backbone of what we do. Because we're a nonprofit, we're really not here to make money, so to say. So it's in our benefit to not build from scratch, to reuse what we can, to be able to make tech transfer easier, to build products that can scale, or potentially in some cases be multi-tenant or used by many parties. It's really UNICC's core mission is delivering solutions with economy of scale. So it's kind of behind what we do and behind our cost recovery mandate and cost transparency initiatives. We're highly open source driven. We have a strong digital fluency. We're really quite expert at this point around scalability, both from a business model perspective and the technology, and they kind of go together, right? Technology choices and business model construct and how you operate and sustain solutions and what kind of governance exists around those to enhance sustainability. All of those things that UNICC has been working, learning, failing, improving for more than 5 decades. And especially within the past 10 years or so, we've built a very, very strong acumen around cybersecurity. So this is at least an optional offering on all solutions that we propose. And in the context of SMILE, this was some of the work that UNICC did, not just to build and deploy parts of the solution, but also to enhance cybersecurity mechanisms around that and some training, things like that. It's a kind of high-level model of UNICC's offerings, specifically around public solutions. Capabilities in terms of application development or application deployment and customization can all be done on different types of cloud environments or on-premise. We have all the different variety of capabilities from helping build cloud environments or cloud-like environments to owning and operating our own OpenStack instance, to working with industry partners like AWS, Microsoft, Google, and more. We're a facilitator and kind of really support best practices around cloud, and especially in the construct of things like architecting landing zones and strong cybersecurity and authentication around these types of things, no matter which cloud environment or any hosting environment. And so in that construct, we're pretty experienced in the context of delivering digital public infrastructure, health solutions, DPGs, trade, learning. We have use cases across many different sectors. Around that, we've provided data and analytics to help with insights on top of some of these solutions or around them. And we're just starting to deliver really key artificial intelligence capabilities surrounding that. So to integrate AI in DPI and to leverage DPI for AI. And there's an element of empowerment and training around all of this. So in a lot of these use cases for DPI and health solutions that UNICC has deployed, the key construct is to leave the knowledge in the place where it needs to be, right? Not necessarily with the implementation partner per se, although that's something that can be relied on in case of retraining or in case of an issue, but really more to be able to help local partners and local institutions to understand and operate their technologies. So this depicts the kind of teams that we put together and solutions we provide. There's a couple of different ecosystem enablers from UNICC's capability stack. Right? If you're interested, you can go to unicc.org, and we have a page where you can see all the different types of services that are there, and it gets into a lot of detail, but we sort of package some of these things here. So I'll mention DPG and DPI hosting. You know, it's AI capable because we have AI capabilities sort of integrated either in our public cloud offerings, certainly as a broker, or in the context of our OpenStack integration with AI Factory. So have the possibility to also look at different hosting architectures and building landing zones into those architectures in order to be able to preserve some kind of privacy and more strong authentication and access mechanisms. Cybersecurity is a really core pillar here, whether it be in the context of any cloud environment or moreover in terms of different solutions deployment. Oftentimes, it's the way solutions are implemented and operated that is key in terms of privacy and in terms of resiliency. And so cybersecurity is a very key component for us in terms of both recommendations during implementation and implementing these mechanisms, as well as training and awareness around how to operate in a cyber secure way, and what are the technologies, what are the practices, what is the governance around all these things. If it's okay, Anu, I'd like to hand it over to you on digital identity and digital health, because you and your team with UNDP have been really key in delivering a lot of these solutions. So please go ahead and take it away.
Thank you, Emily. Hello, everybody. As Emily has alluded to, we do a lot of work in different areas of digital delivery, including digital identity, digital health, scaling up solutions. And we have a team within UNICC that's called Digital Delivery, who are key to building most of these solutions, custom solutions, building on different technologies, etc. And we have done some considerable work with different UNDP agencies, UNDP country offices, and thereby supporting, the governments and member states on their roadmap to enabling citizens with identity solutions. So, for example, in Malawi, we work with UNDP Malawi to support the National Registration Bureau in building different kinds of credentials and solutions, given that the country has a low internet penetration. So looking at solutions that can work offline to enable citizens who probably don't even have a smartphone to have their identity verified in order to receive benefits from the government. In 2025, we built for them a QR-enabled biometric solution. So having a QR code that encodes the biometrics of a citizen that they can carry around in their physical wallets as a copy. Farmers use that to get agricultural subsidies in Malawi. We also built a national registration solution for the registration of for civil registration and vital statistics. So registering all important events in a person's life, including birth, death, marriages, which greatly helped Malawi deal with social problems like marriage of underage girls. So solutions that are working on the ground to solve for real problems. And currently, we are also working with Malawi to build their national ID, digital ID, already rolled out to 13 million people. We did a proof of concept in 2023, and now we are scaling it up, and it would be launched later this year. So multiple different solutions around digital ID in Malawi, and then of course digital health, which is what we want to talk about today, specific use case for Indonesia. ICC has considerable expertise in this area. Our digital delivery team has been building multiple different solutions, catering to different clients in different countries. So we have seen several different business problems, and we are very, very experience. There's a lot of experience coming from our team collectively on understanding use cases from different countries and clients and building on it. We have a comprehensive digital health ecosystem that covers a wide range of different applications. So our portfolio covers vaccines and logistics systems, immunization and immunization management, similar to what we built for Indonesia as Smile, but also in countries like India for even solution. And also, as we'll see later, how Smile was taken globally to other countries. We also cover supply chain tracking and waste management, real-time data dashboards that help with decision making for healthcare workers, and also integration with national health systems to have a one data source. So data is relevant and it's flowing real time for helping to make with decision making. Also to see the patient's portal data as well to make informed decisions. The business value delivered by a health solution, while summarized in a slide, is definitely way more. And as we will see with Smile in the later slides, we will also articulate what the impact has been by rolling it on the ground. But in a sense, we work for economies of scale, looking for efficiencies, how to automate the logistics and inventory and reporting across multiple facilities. Smile, for example, in Indonesia connects over 12,000 health facilities, pharmaceuticals, and pharmacies and labs, right? Freeing up the healthcare workers' time to focus on care. Data-driven decision-making, as I mentioned earlier, which is based on evidence and predictive insights for demand forecasting and allocation of resources. Helping to reduce waste, optimizing costs by preventing stockouts or overstocking of vaccines and supplies. We will look at actual numbers for Smile in a bit, and helps to lower logistics, storage, and cold chain costs. Scalability and adaptability, this is foundational to any solution we build. We make sure it's interoperable, it's scalable, and it is adaptable. We also made sure, given the requirements for Indonesia, that it was easy to roll out to new regions or adapt to new use cases, that it was customizable to the regulations of the country and the ministry, and ensure that it aligned with the workflow of the process itself. It's also designed to ensure that it's compatible for interoperability, keeping all the standards in mind. We build stronger public trust through this process. It improves the service delivery, citizen and end beneficiary satisfaction. Transparent systems also make sure that accountability improves and there is trust in public health initiatives. We work very closely for partnership and donor readiness. So in this case, very, very close collaboration between UNICC and UNDP Indonesia to ensure that the data that we are capturing is quality assured and verifiable for reporting back to funders and partners. It aligns with global health standards, such as that of WHO's and frameworks, and also that there is a way to measure impact, increasing eligibility for grants. And so I would like to present our use case for UNDP Indonesia, where we partnered with them to build the Smile application. This initiative sits at the intersection of the work that we do in the digital delivery team for building the solution and our partnership with UNDP, and thereby by extension with the Ministry of Health. It is framed around digital public solutions approach. And from a strategic standpoint, the goal was to create a scalable, interoperable solution that is aligned with digital public infrastructure principles. And the real work began when we started translating that into something that could function in a very specific context, in this case for Indonesia, right? And our digital delivery team has worked very, very closely with UNDP and the ministry folks to design and build a solution, keeping in mind it had to be adaptable and aligned with local system and needs. But the story begins before ICC even comes into the picture. And I think at this point, it would be important to hear exactly how Smile was born directly from the client. And I'd be very happy to bring in Vidia Darmawi to speak on the concept and the inception of Smile. Vidya, over to you.
Okay, thank you, Anu. Probably most of you asking about what is Smile about. So this system was originally developed in response to several key challenges in immunization program in 2018. So it was identified early on by MOH and UNDP. There was a continued reliance on fragmented paper-based system, and it limits the end-to-end visibility of vaccine inventory. There was a persistent stock out and wastages undermine immunization coverage, of course, and efficiency. There was limited transparency and accountability in supply distribution across 10,000 community health centers, but now it's growing to 25,000 health centers because it's also involved the private hospitals, clinics, private clinics across the country. So Indonesia is archipelagic country with around 17,000 islands. So 25,000 health facilities make sense. So the assistance at that time was aimed at building a digitalized supply chain management system. It's drawing on the success of similar model in India for its national immunization program, with support from Gavi and later coming in the Global Fund to UNDP Indonesia and MOH has successfully strengthened the digitized supply chain management for vaccines and medicines monitoring logistics across the countries. So the principle of this system is that all stock movements at the last mile will be displayed on the dashboard, ensuring that both central and subnational logistic managers are aligned. We can now precisely identify where the stockouts, nearly stockouts are occurring, and system automatically sends messages for replenishment and reallocation of the stocks from facilities with slow movement to those with high demands. There are other features, but I cannot tell you more about that. Probably we can have another sessions on this. So there's a lot of features and also reminders that we send to the users that help them to manage the stocks. We are also leveraging the use of Internet of Things to monitor vaccines and medicine temperatures remotely. It's from around 6,500 vaccine refrigerator, and also now warehouses with advanced connectivity to the system. It aimed creating an efficient and sustainable healthcare system, and evolved to largest ever implemented by the Ministry of Health, and is recognized as the backbone of the National One Health Platform, or we call it Satu Sehat, for logistic part. So the key factors that make the system more attractive and sustainable, it might be not visually appealing, but was built by with the health workers at the center of every at the very beginning. Although it started in 2 districts with less than 100 health facilities, and now growing to 25,000 health facilities. And we introduced dual platform approach, a web-based system, and also mobile for a logistic manager at the back office. It's for the web-based system, and also mobile-based application for health workers at the community health centers. So from the technical standpoint, we adopted a cloud-based big data infrastructure as our foundation. As the system scaled, we also introduced data archiving mechanism and developed a more sustainable and efficient data storage architecture. So in any system, we must build a solid standard operating procedure first. It's not the other way around. So the system followed the SOP. So in this case, the business developers should fully understand the underlying logic from the outset. A careful balance of medical system development and operational expertise is therefore required. And this approach helps avoid unnecessary system modification later, driven by just nice to have features rather than essentials need. And these SOP are not always well written. In such cases, we need to work closely with our clients, such as MOH, to review the activities, identify challenges, and determine how technology can effectively support operations at each stage. So in this slide, I'm not going to go through this, but this is a brief or visual that the supply or the stock was moving from the central level down to the provincial level. So it goes to from the manufacturer first, and then it goes to the warehouse at the central level, and it goes to the provincial district health office. It goes to the district health office, and they're the one that would decide and have like a helicopter view which health centers that needed the most, which materials, and it will goes to the health centers. And it's not only for the inventory or stock that can be used, but also it monitors the discarded materials. So the waste management in healthcare facilities is now the one that growing in Smile, and it's another important features that we also develop, and it's part of the Smile. Okay, back to you, Anu.
Thank you, Vidya, for that very insightful overview. Emily, please, can we go to the next slide? Thank you. This is the summary of our partnership and engagement with UNDP Indonesia. It all started in early 2023 when Indonesia UNDP reached out to us. They had already built this platform. It was running on, the older version, Smile 3.0 was running, and they reached out to UNICC, having heard about our capabilities in digital delivery and seeking a partnership where we could jointly build Smile, and move it to the next version, along with ensuring that we brought in best practices in coding and delivery, as well as governance, and also ensuring at the time when we took this over that, the Smiles code was also in the local language Bahasa, so that we could standardize and translate this to English and ensure along the way that Smile was a digital public good and that it was ready to be also rolled out or scaled up globally if required. And as we'll see, that has been happening. So we assessed the readiness of Smile, looked at what are the gaps that were needed, that were existed for us to fix or change and upgrade it to the next level, identified and jointly, agreed to a platform delivery approach and started working on supporting Smile, both with application development, infrastructure support, and cyber securing it, ensuring that it was definitely, there was strong data governance and data protection measures built in. And throughout 2024, we focused on building and scaling the platform, enhancing features to Smile 3.0, also at the same time designing, and it was a monolith architecture. We'll also be seeing the architecture shortly, but when we took over, the architecture was monolith. So looking at how we could make it more modular and scalable for Smile 5.0, strengthening different aspects of the solution or platform, including cloud components, security and data foundations, and also ensuring that delivery was agile based and process oriented work streams were deployed. In 2025, further enhancements were brought in for Smile. Multiple other features and capabilities were built. We integrated it with the DevSecOps practice that UNICC provides, and different capabilities and features were released throughout 2025, including a logistics module, the waste management module, which comes from a different open source solution called Digit. So we incorporated their waste management component to the Smile platform, so that all medical waste could be tracked from the time it was discarded at public health centers to its disposal safely. And finally, immunization modules, plus a lot of executive dashboards for real-time data access and management, right? TPG registration also began around this period of time to ensure that given that SMILE was now qualified and it met all the standards for being a digital public good, and steady state operations are parallelly being rolled out in 2026, with the vision that in early 2027 to mid 2027, the solution is ready to be handed back to the government. And in a nutshell, this is how UNICC operates or engages with UN agencies in countries. We build solutions, operate it, transform, and then train and transfer it back to member states so they can, they have the capability and capacity to run these solutions. Okay, so that's the model we use. And in summary, our digital delivery team, from a partnership perspective, our teams worked alongside UNDP and the member state stakeholders, ministry stakeholders, to ensure that we shaped up the use case and that the solution was adoptable and sustained in the long term. And what's very important here is that this was not just about deploying technology, it was about building something that the system could actually use, that it fit into existing workflows or processes that were already running on the ground and responding to real constraints in the country. And that is a solution that is scalable and can evolve over time. Also, we are now seeing early traction, so there has been quantification of impact, efficiencies, etc., which reflect not just the solution itself but the way it was designed and implemented. Smile is a cloud-based solution, and it was also piloted in over 60 plus facilities initially when it was launched. Now it runs in over 12,000 plus healthcare facilities, and it also has connected with multiple health systems like Satu Sehat, which is a central health information system, so that there is complete data flow within the one data system that Indonesia has designed. Yeah. With this, I think we can now step into seeing what the architecture of Smile looks like, along with key features of digital health solutions. And for this, I would like to bring on stage Shweta Pujari, who's a service owner and who leads the digital delivery work for Indonesia. Over to you, Shweta.
Thank you, Anu. I will now take us into the technical heart of this session, walking you through what Smile is, what it does, and how it has been built. But before we look at the platform itself, I wanted to give you a brief sense of the team behind it that worked with UNDP Indonesia. So UNICC's Digital Delivery Division is a team whose mandate spans the full spectrum of modern digital development, bringing together 6 core capability areas like custom development, digital identity, digital business, enterprise solutions, AI, and data and analytics. All of this sits on a foundation of cloud or on-prem infrastructure governed by rigorous security standards and supported by operations, with every engagement delivered within the structured program and project management framework. What makes this relevant to Smile is this: we are not a single purpose team that built one tool. Smile draws on our cross-cutting expertise in custom development, data engineering, automation, and enterprise-grade solution architecture. And that breadth is reflected in the platform you're about to see. With that context in place, let us look at some of the key features of the health solutions we've built. Our platforms are mobile first, designed to work in low connectivity areas. They integrate smoothly with existing government systems and follow recognized international data standards. They are modular and can be configured in local languages to suit regional process workflows and policies. Most importantly, they maintain the highest level of data protection and sovereignty, and they enable data-driven planning by providing real-time visibility for evidence-based decision-making. These 5 capabilities do not exist in isolation. They are the answer to a very specific operational challenge, in this case, managing an end-to-end health supply chain at a national scale. Let me show you what that challenge looks like. What you see on the screen is the end-to-end health supply chain workflow that Smile supports, from the earliest stages of program planning all the way through to waste disposal. This is not a simple pipeline. It spans government decree, procurement, central distribution, last mile delivery, consumption, and disposal, all of which needs to be tracked, coordinated, and reported on a real time across thousands of facilities nationwide. Let's start on the left with the upstream layer. This is where the program originates. Through formal proclamation of a national decree flowing into planning and review. Planning defines the targets and timelines, and auditing provides the accountability mechanism. And critically, the audit findings feed back into the planning. The system learns and improves over time. At the heart of the workflow sits the distribution. This is where the complexity of the health supply chain management becomes most visible. Goods enter through a central delivery and are distributed through 4 modes. Push mode, where it's centrally driven and the supplies are sent out to the facilities based on planned allocations. Through pull mechanism, where it's demand driven and the facilities request what they need. Return of unused or excess stock that's moved back up the supply chain. And transfer, where there are lateral transfers between the facilities at the same level. Alongside distribution, inventory management, asset management, and quality monitoring run continuously, ensuring stock levels and cold chain equipment are tracked and maintained throughout. On the right side, we have the exit layer. So once the supplies reach the health facilities, they enter the exit layer, covering consumption and disposal. Disposal feeds directly into the waste management, which we'll see is now a fully integrated module within SMILE 5.0. Underpinning the entire workflow is the monitoring and the reporting layer, operating at 2 levels: operative supply chain status tracking for program managers and executive performance reporting for national decision makers. Both feed back into planning, creating a continuous improvement loop. Every box in this diagram needs to be digitally supported, tracked, and reported on at a national scale across 12,000 health facilities in 34 provinces. That is the mandate SMILE was given. And that is why we will now see the architecture of SMILE has had to evolve significantly to meet it. Let us now look at the architecture that powered SMILE through most of its growth and why it became necessary to reimagine it. What you're looking at are 2 core applications that made up SMILE 3.0, a logistics module hosted on cloud and an immunization module hosted on-prem. 2 separate applications, 2 separate deployments, 2 separate set of infrastructure to manage and maintain. On the logistics side, there's a main service, which is central to the application, a dedicated report service, a notification service, authentication service, and its own database. The immunization module followed a very similar structure, with one addition: an IoT logger to handle temperature data from remote monitoring devices across the vaccine cold chains. Now, this architecture served SMILE well in its early years, but as the platform expanded into logistics, waste management, and other programs, 3 structural limitations became increasingly difficult to work around. First was duplication, where every new module required its own notification, authentication services, etc. Secondly, fragmentation. There was no unified view of data because of the segregated environments. And thirdly, limited extensibility, which meant adding a new health program would require replicating the entire architecture. This was not a sustainable path for a national health platform. And so to overcome these inherent limitations, SMILE 5.0 platform was designed. SMILE 5.0 is considerably more detailed, and that complexity is intentional. It reflects a platform built to carry significantly more responsibility. I'll walk you through each layer now. So on the top left, you'll see every request passes through a Cloudflare for protection and performance through DNS routing, NAT gateway, and then load balancer, ensuring high availability and protection from the first point of contact. There's an AWS secret manager at the bottom, which governs all the credentials centrally. Moving to the services layer, this is where the most significant transformation from 3.0 is visible. Rather than duplicating services across separate applications, 5.0 introduces shared microservices, each with a clearly defined responsibility. The core service runs the central business logic. The IoT service is dedicated for device telemetry and temperature monitoring. The main service operates for the primary application workflow orchestration. Notification service serves as a one engine for all the modules without duplication. The warehouse service is for supply chain and inventory operations. Sync service is for data consistency across distributed environments. And finally, the web app service for the front end. All these services share a common database, communicate through Amazon MQ for messaging and Redis for caching, eliminating the data silos from the previous architecture. Moving on to the platform layer, authentication is now powered by a key cloak, which is an enterprise-grade single sign-on across every module from one centralized source. The Interop service connects Smile to Sehat and the national health ecosystem, while the e-learning service brings training and capacity building directly into the platform. One of the most powerful additions in Smile 5.0, and something that didn't exist in 3 at all, is the data pipeline. With all these components, the platform streams data in real time into ClickHouse, feeding both an operative dashboard for program managers and an executive dashboard combining Smile and WMS data for the national decision makers. The waste management system is now fully integrated within Smile 5.0, replacing the standalone MeSmile solution. It shares now the same infrastructure, messaging layer, and data architecture as the rest of the platform. On the right side, the external applications that connect to Smile 5.0 are indicated, and towards the bottom, you see the external applications connecting with the waste management system. Smile is no longer an isolated tool. It is a central hub within Indonesia's national health information ecosystem. And finally, on the extreme right, you have tools used for observability, which provide a complete visibility across every service and request. And at the bottom, you have for deployment an Elastic Container Registry, Terraform, Kubernetes that enable a fully automated container-based deployment infrastructure as code, making releases that are consistent, repeatable, and auditable. So to bring together everything that we've spoken so far, what we have seen is a transformation from a fragmented two-application model built for a specific purpose to a unified cloud-native platform built for scale. Smile 3.0 served Indonesia well. It proved the concept. Smile 5.0 is the infrastructure that will carry it forward across more programs, more provinces, and more health challenges without having to rebuild from scratch each time. With this, I'll hand over back to you, Anu. Thank you.
Thanks, Shweta. I think that was very beautifully laid out, the transformation of the Smile platform. Now we can look at what are some of the results of, and the impact on the ground now that Smile is running. The new version 5.0 is running on it, and the key results around it. I'm cognizant of time, so we'll keep this brief. In summary, these are the key results for Smile. It has been, as mentioned earlier, digitized and rolled out to 12,000 plus cold chain points across 500 plus districts and 38 provinces, linking multiple different private practices and Posyandu in the country. 1 billion plus vaccines administered across HIV, TB, malaria, testing kits, and Bennett. And healthcare waste management has been implemented in 60 plus hospitals and across 14 provinces. 11,000 plus tons of medical waste a year are being quantified and disposed of responsibly, and 60,000 logistics handlers and healthcare workers have been trained on Smile. Now, I had the privilege of being in Jakarta, going to the local healthcare facility and seeing Smile in action a few months back. And let me tell you, there's nothing greater than actually hearing from the end user or the beneficiary on how their lives have improved, how the quality of work has changed using Smile applications. So seeing it in action, especially seeing how medical waste is being responsibly disposed of, seeing how the cold chain inventory is working, IoT devices are working, and just data collection in general has transformed operations in this area in Indonesia. It's definitely validating for us. This is the true reward for work delivered, and it highlights what a real partnership can deliver with strategic planning, delivery capability, and liaising with UN agencies and ministries, stakeholders to deliver something that works on the ground. This is not it. We have more to share. So there is operational efficiencies as well, and Vidya will talk to it. Vidya, please.
Adding to Anne, who said that this is not merely about technology. So there also continuous performance monitoring and coaching to the logistic personnel. And it's essential to sustain efficiency and data quality and their awareness to take necessary actions. So it has to be like alerts in the system, but without responsive and accountable personnel, allowing them to prioritize their action or like distribute the supplies to other facilities when they need it. So it will not reduce the wastage and improve overall resource utilization. And also, from that, we can see that there is a clear evidence that the return on investment, there's a study and benefit cost ratio to this digitalized system, it's nearly 4 times. So this impact is more critical in vaccine management because there are many health facilities with limited or unstable electricity, which directly affects the refrigerator performance. And it's not realistic too to expect the logistics staff to monitor temperatures continuously for vaccines, and particularly when it's outside working hours and during weekends. So this is how the technology with the Internet of Things, they can see regularly by technology and send the data through Smile with the data temperature, so the health workers can immediately notify it of deviation and take action from there. And this is a new yet anticipated development in UNDP Indonesia for the country, that one we are proud of, that as we build this large-scale system with UNICC, it must be sustainable, scalable, and adaptable and easy to adopt. That is why we choose an open source microservices architecture, and the source code is owned by UNDP, helping to avoid vendor lock-in and can be transferred to the MOH and also other countries in need. So now we are taking a more progressive step by democratizing Smile and registering it with the Digital Public Goods Alliance. This means that Smile will soon be freely available to use, adapt, and share, reflecting that UNDP's commitment to championing inclusive, sustainable, and equitable access to health and technology, particularly in low and middle income countries, in support of the Sustainable Development Goals. So I will pass the floor back to Anu.
Thank you, Vidya. I think it's a good point you mentioned on open source and no dependency on the vendor, because the next slide speaks to a certain challenge that UNDP Malawi faced with this situation. So let's wrap with this final slide. 2024, UNDP Malawi and UNDP Indonesia under South-South cooperation arrived at an agreement that Malawi could implement the Smile solution. At the time, Malawi had a solution called EHIN. The branding was EHIN, built by an IT vendor, but there was a vendor lock-in issue, and they were running out of time, the license period with them, and there was real concern with the Ministry of Health of Malawi on how they would continue beyond that point. And this is where Smile entered the story as an open source solution with no vendor lock-in. And UNICC was the go-to implementing partner, given that we were already partnering with UNDP Indonesia on building and upgrading Smile from 3.0 to 5.0. And therefore, under a joint partnership, ICC built Smile 3.0 for Malawi, and today it's running successfully. It's been handed back to the ministry there, and it's running successfully, rebranded as EHIN, so that the end user is not confused about the solution per se, branding wise. And we are very proud to say that we have been a key player along with UNDP in making Smile a solution fit to be global. And now that it is in nearing completion as a DPG, I'm sure the doors are opening in multiple other places for Smile to be implemented. And with that, I would like to wrap up and by summarizing that Smile has truly evolved, from being into managing logistics for routine immunization to managing COVID-19 vaccinations, collecting vaccine temperatures using IoT devices, providing help desk support, etc. It has truly grown. We have been very proud to see the growth of the solution, and it's a testament to the partnership that we have with UNDP. Over.
Thank you. Thank you, Emily, Anu, Vidya, and Shweta. Like, this is a very, very comprehensive, I would say, that explanation or the sharing. I think we could see the whole gamut, like how this evolved and also evolving and continuing to cater to the evolving needs. And then not only that, like it's also like, you could also show that this is also being able to be replicated elsewhere in another region, another country. And then this is very, very interesting. And thanks for actually sharing with us. And especially just at the time of our conference also on the topic of digital public infrastructure. I know we are at the top of the hour already. Just a quick question, because this is also usually comes up. We actively work with the governments, typically the ministries of health, and in supporting the national digital health programs. So now that like many of them have joined here also, like, but for a country to actually start working with UNICC on such a project, what exactly is the process? Like, whom do they approach? Do they have to actually take the route of approaching an UN agency like UNDP and then get across? Or is there a channel by which they can directly get across to UNICC? This is something that I would like to ask because it will be of relevance to our members here. And then, like you also mentioned about private players, right? So, for example, clouds. And this being a UN system, and then it's also a non-profit motive, like how do we actually combine both? If you could throw some light on that, and then we could close. I know there may be more questions, but probably we can collect it and then I'll also get it across to you. Thank you.
Of course. Maybe I can speak to that. And Anu, I see you have your hand up, so I can complement. So in terms of engagement, UNICC works in both channels, and really it's up to country stakeholders which channel they prefer to engage. In the case of UNDP and Indonesia, there's a long-standing history of discussions and interaction around SMILE, and as is the case in some other initiatives. And UNDP and UNICC have worked together since UNICC was incepted 55 years ago. And so this relationship is very strong, and UNDP very often comes to UNICC, and many other UN partners come to UNICC for supporting a variety of different initiatives. So they know about this channel, and we're happy to support. Countries are also welcome to approach UNICC, and sometimes we may choose to also work with other UN partners in that process. There's a variety of different aspects to serving countries, and it's very important to also look at what countries really need, right? And very often there can also be aspects of privacy, can be aspects of policy, can be aspects of substantive work that is in the mandate of our UN sister agencies. And so these are, elements of collaboration can be very important. And so the work ahead and the initiative, we can work directly, we can make recommendations. We're certainly very happy to complement and extend the work of our partners, especially as it comes to technology delivery. And in that respect, we have a plethora of different partnerships that UNICC has with different technology providers. So we're essentially a broker of many of the cloud services. We also work with local technology partners. In some cases, for example, in the context of country delivery, UNICC works in the construct of a lead implementer. And so some countries prefer, or some partnerships prefer, that there's a variety of local stakeholders or local companies that are also part of the process. But they may not have as much experience, or there may be certain gaps, or certain entities may be working on parts of a solution versus others. So all of these different mixes are important, and UNICC can provide this. We have a variety of different strategic partnerships, not just with cloud providers. Certainly, they're a big backbone for us, and we have a long history of being a compute center for the UN, hence our name, but we're much more than that. So Anu, if I forgot something, please feel free to compliment.
Thanks, Emily. I think you covered it well. I think in summary, it's true. We can work either directly with countries or with UN agencies, whatever fits, the client best. I think in the context of Indonesia, I would also like to say we are exploring multi-stakeholder partnerships. So that means working in a consortium model with UNDP or UN agencies, member state, the ministry stakeholders, as well as with research partners such as universities and then local tech vendors. What this does is that we build or bring different capabilities to the table to further strengthen the collaboration. So multiple ways to work with ICC, and happy to answer any questions, or if colleagues in the room want to reach out later, we can have a discussion.
Thank you, Anu and Emily. I would also like to acknowledge the presence of Pak Gufran Mukti, who till recently he was the president director of BPJS Kesehatan, the National Health Insurance Agency. Honored to have you, Pak Gufran, to join us here. And then for Vidia, since we have the event in Jakarta, if the Ministry of Health would like to actually showcase this work during our event, there is an opportunity. We will also get in touch with you. If there is interest for the Ministry of Health to showcase this to our conference, we'll be happy to work with you on that. Thank you.
All right. Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Thank you, UNICC team, and Smile. See you soon.
See you, Jai Ganesh.
Thank you.